I'd love for you to paint an outline on what the different recovery stages look like, starting with diagnosis, and how that might differ for someone who's had multiple concussions like Bella.
Fair enough. I think we just started to hear some language about stages, which is interesting. So concussion recovery is known to occur over a sequential number of stages. Typically, there's 6 of them. It's a progressive nature of activity or stress, as I like to kind of more say it in a more global term. The one thing that I would say around that is sometimes we've made a lot of progressions with stages. Sometimes there's a little bit of difficulty in practice when people get caught up in stages. So I'll at least outline the stages, and I want to kind of maybe reframe how we think about concussion recovery. So the stages would be from the point of the non-negotiable rest. You want to take 24, 48 hours, you're not doing anything. You're trying to get the injury to settle in, understand what the main symptom complaints are, not putting yourself at future risk. Then after that time, stage 2 would be a reintroduction of physical activity, and that's a low-level aerobic level. If that goes well, as long as there's not too much symptom exacerbation, you move on to sport-specific movements, you increase risk with more team activity, you have a full practice of risk, and then that would be the sequence of stages. You need 24 hours before you progress to each stage. And so as I kind of talk about this, you can see there's a lot of stages, nomenclature, 24 hours. And in practice, that sometimes is very difficult for coaches, practitioners, more often the patients. And so the way I kind of look at it in a more global term is just think of your recovery as elements of stress. And there's really 3 main components. There's physical stress, cognitive stress, and sensory stress. And so concussion recovery really is the first stage, and the first movement is you want to only do one at a time. And you want to introduce physical activity. So you're seeing is that cardiovascular system going to exacerbate issues. And if that seems fine, then you can move to a second stage where you do more physical activity. So you ramp up kind of more stressful, high intensity exercise. Again, trying to see if you're going to elicit symptoms. Again, still maintaining in that physical domain. If that seems to go well, then we layer on cognitive components. That means skills around physical activity, their respective sport, individual skills. And then we layer even more on cognitive elements, team activities, strategies. What's your plays? What are other players going to do? So you're increasing that risk. And the last kind of component is sensory. So on a football practice, bright lights, lots going on, lots of noises, and you're kind of layering the cake of those different elements. So that's generally how I kind of see concussion recovery stages, elements of physical activity, cognitive and sensory. Your second question was about, and actually what I will add to this, that's irrespective of sport as well. Those principles apply to work and those apply to school. And so again, it's helpful to think if you change the context, you can maintain the same principles with just going to class. Don't take notes, right? Adding some elements of note-taking, then having obviously screens and stuff like that involved. So you can do that for both school and work as well. Your second question was about what does the things change with respect to multiple concussions? And, potentially, and that has to do more with when was the recency of that last concussion is probably the biggest driver. But I think there are more salient predictors or factors from a clinical perspective that you're kind of weighing on to how you may treat things. And the main thing mainly is how crappy does someone feel? Because you're not going to accelerate someone through all these stages if they don't feel well. You're going to take your time, and you want to make that. So the other thing to keep in mind is that anytime you manage a condition, it's not just the concussion, or it's not just the ankle sprain. It's what else happened at the same time, what comorbid issues potentially happen. And so with concussion, you have musculoskeletal injuries, neck injuries. They could actually sprain their ankle and also hit their head. So you need to think of comorbid issues. The biggest thing that you need to also consider is what does that patient bring in to that experience? Do they have a history of multiple concussions? Do they have certain personalities? Do they have potentially anxiety, depression? And so in totality, those are the things that are potentially going to, dictate how fast or how slow you move through that recovery process.